Namaste, I am Dr. Sahiba Sethi. I'm a specialized glaucoma consultant at Arunodaya Deseret Eye Hospital on this occasion of International Childhood Cancer Day. And I will be sharing some tips with you on how to take care of your child better if he's been detected with cancer. And I hope this gives you a little ray of hope and also little direction on how to act. So childhood cancers are very aggressive cancers. This is one thing that we really have to understand, and very importantly. And because these childhood cancers are very aggressive, timely treatment is extremely important. So early detection becomes the mainstay of treatment. So I urge all the parents and primary care physicians to timely detect this, and if the facilities don't exist, refer them to higher centers so that diagnosis and treatment can be done at the right time. This will significantly improve the survival rate of the child, and also early intervention would mean lesser aggressive therapy, which means lesser complications. The overall quality of life of the child will be better, fewer post-operative visits, lesser cost, less pain, just generally less complications from treatment. So the childhood cancers are actually genetic mutations. So this is something that the child is born with. There is a defect in the child's gene, and there is very little that one can do to prevent this. So preventive strategies don't exist when it comes to childhood cancers, and treatment and timely treatment is the only mainstay of therapy. Chemotherapy is usually applied as a first-line treatment for childhood cancers and works really well. The prognosis basically depends on at what stage the cancer has been diagnosed, and also largely on the type of cancer your child has been diagnosed with. But children, they tolerate this therapy much better compared to adults. So the prognosis is usually fair as long as timely treatment is intervened. Long-term follow-ups are also very essential. Even if the childhood cancer has been curbed, has been controlled, long-term follow-ups to see what effects on growth and development of the child the chemotherapy or the treatment strategies have taken place also is extremely important. So the commonest childhood cancer is actually leukemia, which is also in layman terms called blood cancer. Now, what happens in this cancer is that your blood counts are low. So which means that the child's overall immunity is low. The patient will have symptoms like fever, which is not going with treatment. They will have recurrent infections. They may have swollen lymph nodes, generalized muscle wasting, fatigue. The child feels very tired very easily. Unexplained weight loss, any bone pain, any pain otherwise in the body which is unexplained, or any swelling of lymph nodes which you can palpate here, maybe under the armpits. So anything unusual that comes to a parent's attention should be taken to the doctor's attention to rule out these childhood cancers. As far as the eye is concerned, retinoblastoma is actually the commonest eye cancer, but it's a rare condition. It can be picked up by parents if they see a whitish reflex coming from the eye. So usually we say that your eye has had a red reflex when you take photographs. So in children with an early stage of retinoblastoma, that red reflex is actually going to be white. The child may have visual symptoms. A child's eye may be misaligned or cross-eyed, a squint or deviation of the eyes, vision problems, any pain or swelling of the eye. All of these are very important telltale signs to actually bring your child to the ophthalmologist to rule out for retinoblastoma. So I think the most innovative breakthrough in cancer treatment for children is the role of AI, artificial intelligence, in actually diagnosing early cancers. So this is going to change the game in diagnosis and treatment of childhood cancers. Apart from this, there are various other newer therapies which can control the cancer well. Now, these are newer chemotherapies which are less toxic. They have fewer complications and fewer long-term side effects on the child and work well. There are also newer radiation therapies in the form of proton beam therapy which cause less collateral damage. There are genetic therapies that also can be targeted towards a particular kind of cancer. Then there are also immunotherapies, newer immunotherapies, which actually incite your immune system to fight against cancers like lymphoma and leukemia. I think my most important tip or advice to parents would be to have a regular checkup for your child annually. Whether or not you see any problem with your child, an annual checkup with a pediatrician is going to be very important in diagnosing any problem, any unfortunate illnesses that your child may be suffering from. And like I always say, a mother knows best. So trust your instinct. If you see there is anything off with the child, which could be in the form of persistent fever, unexplained weight loss, the child gets tired very easily, any unexplained pain anywhere in the body, you must take it to your doctor's attention and not ignore it. If you belong to a place where medical attention is not very adequate, you should not hesitate and not waste time in getting a second opinion, maybe move to a first-tier city and get advanced treatment if necessary. Pediatric cancer treatment can actually be a very extensive and an expensive proposition. These treatments can be extremely costly. This is a long-term therapy. It's going to go on for many years. Financial aid is something that the parents are usually looking for and coming to us doctors asking for help. So this will be my advice to put out there, that it's extremely important to get your child insured under the critical illness policy. So there are various government and private insurance companies that can cover fully the cost of pediatric cancer treatment. So one should opt for it, especially so if you've had a family history of certain cancers or illnesses. It's extremely important to insure your child right from birth. So medical treatment is actually just a part of your child's cancer treatment. A holistic care and community support is also equally important. This can be given by your doctor, by your institutions in the form of physiotherapy, in the form of rehabilitations. Your child may need psychological support, may need some counseling to deal with this. It may be not a bad idea for parents also to have some psychological counseling, some support system, some community counseling for them to deal with this better, so that they keep their hope alive, and so do their children. And as for doctors, my only request would be to treat your patients and their parents as family, because the holistic care is extremely important for them to deal with this, as well as making it easier for you. Parents are heartbroken, they're looking for guidance, they're looking for some emotional support. So for doctors to be emotionally available and for understanding what the child and the parent is going through will make it much easier for you to deal with the situation as well.